welcome to our webinar, which is titled Storytelling for Public Contributors. Before I introduce our speaker, some very quick housekeeping reminders to run through. Our presentation today is scheduled to run until 11:15, and the session is being recorded, so please do remember to keep your microphone muted so we don't pick up any of that background noise. We have time dedicated to questions at the end of our session, but we also want this to be an interactive space. So at points, Duncan, our speaker, may invite you to share your thoughts or reflections, and we'd really welcome your involvement in that. If you are making a comment or asking a question, please either pop up your hand or put something in the chat. That'll help us ensure that everybody has a fair opportunity to make their points. As with any discussion, there may be some differing points of view in the room, and so I ask everyone to respect alternative opinions and allow everyone to feel comfortable to ask any questions or talk about their experience in the spirit of openness and inclusion. I'm sure that goes without saying. The slides from today will be emailed out after the presentation, along with the recording and an evaluation form, which only takes a minute or two to complete, and we really appreciate getting those back. It provides very valuable feedback as we're progressing our offer from the Specialist Centre. During the webinar, you can access closed captions by clicking More on your Teams toolbar, then Language and Speech, then CC Live Captions, and I'll also put that into the chat. For anyone who's watching the recording back, if you want to offer any thoughts, please access the evaluation form via the QR code, which will be shown at the end of the presentation. So on to the main event, on to our speaker, Duncan Yellowlees. Duncan has been training presenters for over a decade and gets really excited about working with research. He feels there's so much fascinating and powerful work being done, and he's really passionate about helping anyone connected with research to share their contribution and involvement in a way that connects and resonates with the audience. So Duncan, I'll hand it over to you.
Fantastic. Thank you very much, Nicola. Hello, everybody. Hi, I'm Duncan. Nice to see a few of you got some cameras on so I can see people. I can see a few of you. You don't have to have cameras on at all. Of course not. But this might be an interactive session. Rosemary just popped up on camera. Hello, Rosemary. And Lynn. God, look at you all joining in. Jania, hello. But if you've not got your camera on, that's completely fine. We can interact in other ways as well. We've got the chat box off to the side that Alex has just posted in. And so as a little warm-up, little activity of the chat box, tell me where you're joining from, tell me where about in the country you are, and tell me, crucially, what are you going to do the moment it stops raining? Because it's been raining for approximately 4 years. And I think we're all really looking forward to it stopping. So tell me in the chat box where you're joining from and what are you looking forward to doing when it finally stops raining, just to kind of check out how the chat box uses. If you are not a fan of the chat box, that's absolutely fine as well. There's going to be points where I maybe ask for input or thoughts from you guys or questions. You can come on microphone and say them. You could write them in a private email to Nicola and it'll get there in about 3 minutes later, and then Nicola can ask me as another way to interact if you like. So we've got some stuff coming in. We have Tom. Hello, Tom, from local authority research practitioner in Cambridge. Fabulous. Second time you've attended. Fabulous. If you're going to go for a walk, Lynn, sorting out your garden, Nicola. Excellent. Go for a walk. Everybody's just, I just want out. I want out the house, into the daylight. Wolverhampton, walk my dog, although it happens in the rain as well. Caddy's out in Whitley Bay. Desperate to get back on the slides. You're going to join in. Just be honest. It's not just for kids. Slides are for everybody. Looking forward to the buds of promise as spring arrives. Absolutely, Yvonne. I saw crocuses out in the wild about a week ago and I got really excited. What else have we got? Northwest, not Blackpool today, but part of Blackpool HDRC. Fabulous, Natalie. You'll be in the garden. Everybody get in the garden. Get outside. Michelle just like, keep on working. We've got to keep on working. There's work to be done from Tower Hamlets. Not so sunny Southend-on-Sea. Looking forward to getting in the garden. Fabulous. These are all good. Okay, so we have a chat box. You can talk to me. I can talk to you. Welcome. As Nicola said, my job is this. I help people involved with research talk about research to a variety of different audiences better. Because if any of you have ever seen a talk about research, they are sometimes quite dull. They are sometimes quite boring, and they take that made Yvonne giggle. Often research and academic practice can take powerful, important projects that are really interesting and are out there to help people. And somehow in the communication of them, they can be made a little bit less exciting, feel a little bit more maybe dry and academic and a bit boring. And that's how I help, right? I come in and try and help make sure that those communications, those presentations, whether they're talking to the public in public engagement settings or policymakers, or even internally inside academia, conferences and things, trying to help make sure that those talks and that work lands with impact. And above all of that is helping those speakers, the people themselves, feel confident doing it. And that's what I think is really powerful, because there's so many people involved in research work. And all of those contributions are really valuable and really useful, but it can be quite an intimidating or scary thing to stand up maybe and talk about it, or talk about it on a Zoom call to, I don't know, your local council policymakers or something. And so helping people feel more confident and comfortable with that is kind of what I do. It's what I'm all about. And we do that with workshops and various things, various sorts of techniques. Today we're talking a little bit around storytelling, but there's stuff that you can think about slide design and body language and delivery as well that I can talk about if that's of use to you, if you want to ask me some stuff about that in questions. So that's the plan. The other thing that we've got that you can interact with me, if you're not a fan of the chat box or you just like emojis, is up the top. There's a little button that says react, and you can click on it. For just a point of reference, all of my jokes are this level of funny. All of my jokes are that funny. So if I make any jokes, that is the correct emoji to use, right? Cool, that's where we're at. That's what we're going to do. We're going to talk for about the next 40 minutes or so about storytelling and ideas and thoughts about how the voices of public and community contributors matter in research and how best to make them heard. After that, we'll have a Q&A. Everybody happy? Ready to go? Sound like a plan? Camera people, you can do thumbs up to the camera. I can see it. It's fabulous. Non-camera people, you can use emojis. Look at this. We'll all go. Okay, exciting. So the first thing I wanted to do was set a little bit of context around the places that public contributors, yourselves, or policymakers might get involved in research and might have to communicate something about their perspectives, something about your lived experience, perhaps, or indeed something about the project itself that you've worked on. So, first place, all research starts with planning out how to do research and what questions we're going to ask. And this is that key kind of design space where we start thinking about what is important, what matters. And in public health, the things that matter to the public are the things that should be mattering, right? The stuff that we should be researching is the stuff that makes a difference and the stuff that matters. So bringing your voices up there is really important. Designing research, right? How the project is put together, what the processes are, that kind of stuff doesn't all have to be academic, and it has to work for the people we're working with as well. Interpreting data. This is quite an interesting one. I'm going to ask you to have a think about these in a sec, so just kind of bear these in mind as contexts. Engagement and sharing. Now, this is traditionally maybe where kind of you think about presentations or you think about dissemination or communication, is when a research project is done or nearing the end and you've got some results or something you want to take back out into the world and share with either your local community or with policymakers or back into research to inform other things. And then kind of evaluating stuff, right? Did it go well? Did it not go well? How did it work? Could we do it better in the future? And engaging with policy to make real kind of change and real impact sort of happen. So what I want is a little thought, and this might just be, for some of you who've been in research projects before, this might be completely obvious. Don't stress it. Some of you may be less experienced in working with research, just useful to think about. Think about these different stages and give me some thoughts in the chat box, or if anybody wants to come on microphone, you can stick your hand up. There's a little raise hand button at the top of the Teams bar there. You can go on microphone and talk about it, but why might hearing your thoughts, your perspectives, your stories, or the public contributors' thoughts and perspectives and stories, why might that be helpful or useful or design better research in any one or multiple of these settings? So I'm going to give you a couple of minutes, have a little think. Yeah, I've just spotted Zoe on there. We can bring thoughts that have not occurred to the researchers before, and that you've really experienced that. Kind of echoes some of the stuff I think in other ones I've just read. We all know our bit. We all know our world, right? And that's the whole point of why public contribution or co-production of research is really valuable, is that we know our world, but we don't necessarily know other people's worlds very well. And if we want to design projects that work for a wide number of people or work for contexts that are not our own, we need to be able to talk about them. And bring in those points of view, which is cool. Adds credibility, which is really good. That's a nice take. And Tasha, I think sometimes the public contribution angle maybe historically, I think it's changing, but maybe historically has been less important or seen as less important than an academic thing. And that's absolutely not true. I think, Natasha, your point there that it adds credibility. This is real people involved in this. They care. These are real thoughts that are going to work in the real world. It's not something just cooked up in the university. That's a really nice way to think about it. Your point, your stuff you're bringing is not added extra. It's actually, this will really work. Right? It helps speak to that point. These are all really lovely. Anybody else fancy coming on microphone? Just one last, if anybody's got any thoughts. Let's see if there's anybody I can't see who's got thoughts. Rosemary, hello, you stuck a hand up there.
Yeah, sorry, just unmuting. Yeah, I've been in all sorts of different things where I've listened and where the speaker and colleagues fully understand everything, but the lay people may not understand. So it's important to, like I put in the chat, that what you're saying is understandable. So that feedback is very important. I've also been, I've got long-term conditions and I'm a tutor of the expert patient program. And I've also been involved in a lot of drug work, addiction work, and bereavement through addiction. So I do find that I can bring not just my own experience, but the experience of other people I work with to co-production training, which has been very helpful. But I can also understand where sometimes they don't want to hear the public voice because some people use these co-production things to just offload. So that can be a big problem, and it can prevent people. You need to speakers need to know how to handle what's coming back. So yeah, it's a two-sided thing.
Absolutely. Some lovely little sort of separate points in there. I think the kind of point about language and jargon is just a very simple, having that perspective of somebody who isn't deep in the research side can just be like, people don't know what this means. Normal people don't know what this means. Academics, you are normal people as well, but if there's any in the room, you are a very niche case of normal people. You know a specialist language and a jargon. And that also the bringing, like, it's not just your own lived experience. Like if some of you are, Yvonne, you said you're a nurse and you've worked in social care and this kind of stuff, bringing your professional expertise as well, not just personal lived experience, but professional expertise of jobs out in public health. Is really valuable as well. Cool. We're going to keep moving on. Yvonne, I see you've got a hand quickly stuck up. If you can keep it to 30 seconds, Yvonne, I can let you talk. You up for that? Splendid.
Oh, sorry. Yeah. Sorry, yeah. I was just saying my daughter's got a disability, and I think it's really important sometimes that we allow easy read in a lot of our literature, because a lot of people out there, grandparents, not necessarily people with disabilities, will struggle. So I think if you do an easy read version, I'm a director and trustee of a few charities where we work with people with disabilities, and I think that's absolutely spot on, and that's what we need to be aware of as well.
Yeah, fantastic. That traditionally academia is quite inaccessible for people who are not in it. The language, the way it works, the way papers are written. You can't even access papers a lot of the time because they're behind system paywalls and things, and more could be done to make that kind of more accessible. Sakia, I hope I pronounced that okay. We're going to have to move on, I'm afraid, but you can drop it in the chat box. There's lots of thoughts in the chat box there. If you can watch the recording, catch up and read the things. But we're going to kind of keep moving on. And what I want you to do is think about a piece of communication or a presentation or presenting your thoughts to a group. And what's the most important thing? What is it we're trying to achieve there? Okay. Don't answer that question. Just kind of mull it in your head. There's lots of possibilities. There's lots of options. There's lots of things that might be most important. Maybe it's most important that we transfer some information, right? We have some information and these people now learn the information, we get that across, our message gets across. Maybe it's most important that it's accessible, it's inclusive, everybody can understand what we're doing. Maybe trying to think of something else now off the top of my head, but there's a whole bunch of different things. For me though, one of the most important things, and I'd like you to I'm going to give you a little metaphor for this. Imagine you are at the park or at the beach and it's not raining, the rain has gone away. We're in the summer, the sun is shining, you're there with your friends, you're there with your family, and you have a beach ball like this one. Okay, and imagine you're there and playing catch, right? Because that's what you do at the beach or the park with your friends and a ball. You play catch. You throw the ball to them, they throw the ball back to you. The sun is shining. Everyone has a lovely time. You throw the ball to your friend, and just as they're about to throw it back to you, you hear a lovely tinkly tune floating through the breeze. Again, stretch your imagination. It's summer, it's hot. This is an ice cream truck. And like all grown-up people, we are distracted by the idea of ice cream. And in that moment, your friend takes the ball and throws it back to you, and it flies through the air. Poof! And smacks you right in the face. And that, for me, is one of the most important things we teach about presenting, about communication, and that is that it is got to be two-way, right? Like a game of catch. If there isn't somebody else willing to catch this ball, there's no point in me throwing the ball, right? Or I'm just throwing a ball at people, and that's bullying. We don't just throw balls at people. And if there's nobody there, we're wasting everybody's time. And so when we're thinking about communicating research projects or communicating lived experience into research projects, one of the goals that we're trying to do is, if the ball is the research project, how do we do it in such a way that our audiences, the people we're talking to, want to join in and want to play catch with us? And that's the kind of core starting point of all of our training on presentation skills. But the real thing it means, and what I think is really exciting for you folks as public contributors or people involved in research, maybe not totally on the research side, is that it means it's not all about the academic stuff. And actually, I have spent a career, 10 years now, trying to get researchers and academics to understand this bit. And they don't necessarily get it. If you want people to catch that ball and feel listen to or want to participate and want to listen to what you've got to say, whether it's local policymakers and council members or whether it's community folks, if you want them to do that, you can't just lean heavily hard on the academic stuff. I think Yvonne's point about having easy access read or easy read type academic papers is really relevant here. Academic papers are the exact opposite of a nice to catch ball. They are horrible. Right, and they're written in horrendous language that nobody really understands, and it's a weird makey-uppy version of English full of jargon, right? And so when we're thinking about communication, it's how do we make this ball good for people to catch? And for me, this is where stories come in, and today is kind of all about stories and storytelling in various ways. So this is about storytelling as thoughts and ideas and techniques, and what we're going to do is I'm going to think a little bit about what makes stories work and why they're interesting to listen to, and therefore what can we pull from them. So storytelling is old. We've been doing it for a long time as a way of communicating with each other, right? We used to draw stories on cave walls, right, in paint with finger paint, and then we would sit around campfires telling each other stories. And for thousands of years, some of the most respected people in society and in culture were storytellers who travel from group to group, tribe to tribe, city to city, sharing stories. And in those stories, there was knowledge, right? There was wisdom, there was science, there was religion, there was faith, there was new ideas, there was philosophy, there was things like, don't drink the dirty water. It'll make you sick, right? First public health messaging. And that kind of stuff baked into those stories, those lessons. And I think there's something really powerful about that. So I invite you just in the chat box, friends, where do we think we find stories now, right? In everyday life now, where do you see stories? Because it's easy to think that we're in 2026 now. Blimey, when did that happen? We're in the 21st century, right? It's all about big data and big tech and academia doing massive research on huge data sets to try and see trends and things, right? We see stories on social media, soap operas and social media. Yeah, absolutely. Everybody's like, it's just socials. It's all socials. Socials are all stories. Where else do we see stories? Just in everyday life around us. Yeah, oh, Elizabeth, I love that. Your kids describing their school day. I have no idea how old your kids are, but I immediately made them kind of quite young, coming home going, Mum, this is what my day was like. But if they're 17, hopefully they still do that as well. Maybe they don't. I'm not sure. I don't have kids. News outlets, TV and news, yeah. Sometimes news, more fact, sometimes more fiction. In religion, yeah, we get stories all the time in religion. Often kind of those lesson stories, learning stories. Sam, lots of podcasts, fabulous. Sharing stories from those. Rosemary, nice. Conversation with friends, absolutely, right? If you've ever done that thing where you have a really good day, out and about doing stuff or at work or whatever, and you get home to your family or whoever you live with, or you ring somebody up and you go, oh, I've had the best day. And then what do? You tell a wee story about your day, right? You tell them what's been going on. Blogs, online writing is all stories told in person, face to face. Yeah, when you work relationally, absolutely. The other one that I really like, I think, real one, you've picked this one up, everyday people on the streets, right? Have you ever been on public transport just on your own, but there's a group of people sat near you and they're all chatting and you just sort of listen in? Yeah, done that. And they're all swapping stories and telling stories and gossiping. The point of this little thinking exercise is that even though we live in a world where tech and big data and data sets, and particularly with public health, right, a lot of the times what we're looking for is big data sets and statistically significant data so that we can recognize patterns and we can spot stuff so we can make interventions that do things. Actually, the way we communicate a lot of the time and the way we like communicating is through storytelling. And that is because stories are really powerful at providing ways in. And I think this is really crucial for this idea of public and community involvement with research, is that it's your perspectives and your stories that provide ways into the research for people who aren't researchers, but also that provide ways into the everyday, on the ground, real world life of public health for the researchers. So it goes both ways, and stories help connect us to these different things. And fundamentally, when we're kind of communicating, one of the places we use them. Oh, I just had some beautiful slides that I completely failed to show you. Sorry, team. Here you go. Here's the ways in slide. Look, it was a nice maze with an animation that I made. We're providing ways in that goes backwards and forwards. Fundamentally, this is about making the unfamiliar familiar. So anywhere where you're communicating to an audience and you've got something you want to tell them that is a bit unfamiliar to them and you want to make it familiar, storytelling can really help. Femi, you've stuck a hand up. Have you got something you want to contribute and say and jump in there, just because we've got a little gap there?
I just have a question of when is a good idea not to use a story? When is a good idea? When would you call it? It's giving someone away and making it familiar, or just leads to the wrong or a difficult or whatever.
So communication is never a sure thing, right? We are never part of the thing about the ball, right? Is if I've carefully designed the ball and I throw the ball, I have no guarantee that they see the same ball that I see. I have no guarantee that they're going to interpret the thing that I tell them in quite the way I want to tell them. We can try our best to make sure that happens, but it's not always going to be the case. So there's always a little bit of a risk. Also, storytelling and story tools and some of the techniques I'm going to give you are not always appropriate. Okay, and when it comes to communication and presentation, the way we think about it is there's a huge big box of tools that can help you communicate whatever you want to communicate, and that includes things like slide design or visual props or aids. It includes things like body language and vocal use and this sort of stuff, and techniques under storytelling. But contextually, context swap and change. So for example, if you were in storytelling is really good at getting people in, which is kind of been my next point about making people care about stuff. So when you've got situations where you want people to care about something, I need researchers to care about the on-the-ground context, or I need folks in the on-the-ground context to care about the research so that they kind of embrace interventions or whatever. Policymakers who need to care about the research in some way. Storytelling can be really powerful there. But if you are in, say, a policy meeting with maybe quite an important minister who's very time poor, and you start, okay, once upon a time, imagine this, they're going to be like, nah, just give me some headline numbers here, okay? So it is a slightly delicate kind of choice. Demi, you've got to think a little bit carefully about the contexts you are working in, and there's a lot of you here, and I'm not familiar with all of your specific contexts, and decide whether these techniques and tools are helpful or not helpful. So it's a slight balancing act. They're really powerful when they are right. They don't go terribly wrong if you use them in the wrong context, so it's sometimes worth a stab if you're not sure. But you're absolutely right to pull up that these maybe don't work in every single setting and every single context that you're maybe working, and that's true for all the tools in the toolbox, right? There are places where slides are the right way to go and places where slides aren't, where audience interaction is the right set of tools to use and where it isn't the right set of tools. and you kind of learn that as you speak and you go through stuff. If you're speaking in these environments, get together with the team that is part of the project and workshop stuff and kind of go, should we try and do this? Should we try these techniques or think about doing this sort of stuff? Is that right here? Is that not right here? Okay. Yeah, good question. Thanks for bringing it up. So fundamentally, stories are really helpful for making people care in various ways, right? We get involved, we get focused. So anywhere you're like, either you want to make the unfamiliar familiar to people, or, and that goes both ways, that goes making on the ground experience familiar to researchers and vice versa, or you want people to kind of get emotionally involved with something. So again, policymakers backing, putting up some funding to make a project happen. Maybe you need them to you kind of highlight how much the problem is an issue so that they feel like they care a little bit more and they want to allocate funding more to your thing and less to others. And one of the hard decisions of policy funding, and particularly in public health, is everything is worth doing, and there's only so much funds to go around. But those decisions have to be made. And if you're pitching for your thing, making people care about your thing can help there. So I'm going to give you a couple of specific techniques, I guess, that maybe are useful in various places, and also in the Q&A we can talk much broader about storytelling in various ways. So specific techniques that I've pulled out of why stories work. What is it about stories that, we've been doing them for thousands of years and we like them and it's kind of imprinted on us that this is a good way to communicate? What can we steal? What can we steal from storytelling to help communicate about projects or about lived experience or those sort of things? So the first one here is talk about places. Put places in. I said I built a career spending my time telling researchers that it's not just about the academic stuff, and it isn't. Right, you can talk about an experimental study design or an intervention, about what you did and the methodologies you used and blah blah and blah blah, and never once mention how the community hall, well, you got together your focus group to talk to them about the thing, what that place was like. How did that feel? Right, just leaving little things about what did it look like. It doesn't have to be a pub. I've got a picture of a pub because I drew a good picture of a pub sign and I wanted to show it off. But anywhere where you have place. One of the interesting things about telling people about place is they start to imagine it. They start to picture it. So how many of you had a beach or a park kind of in your imagination, in your mind's eye? And when we do that, I'm getting you to paint pictures in your heads, and that is a real bit of kind of mental engagement. You're already really deeply engaged because you've started painting that picture with your imagination. You're not just trying to think about facts and figures or data. You're kind of in the picture with me. So thinking about your lives, thinking about your contributions, thinking about projects you've worked on, where are the places? And you can tell me in the chat box, where are the places that public health research happens, impacts? Yeah, where are the places where it intersects with, touches on? There's going to be absolutely tons, but try and be, little specific, and let's see what everybody's got. Give you 30 seconds or so to have a think in there. What I wanted from that, Catherine, you did a great job, and hopefully some of you listening in noticed, is how much more interesting it is when you give just a little description of the place. Like it was, first of all, big and bustling was not what I was expecting. In my head, community centres are quite small things. You're like, no, it's huge. There's loads going on, and it's really busy, and there's mums, buggies, and prams coming through. Those little bits of imagery bring the research much more to life. Bring the project, make the project much richer. For me, I don't know the project, I don't know what you did, but I can now imagine you going into this space and talking to people or doing interviews or data collection of some sort or whatever it was you were doing. And that's the power of putting images in, putting places in stuff, talking about places, right? And for those of you in the community side, not necessarily the research side, these are places these are places you're familiar with, maybe. And that's one of the real values, I think, of your perspectives and experience there. And we've got loads of stuff in the chat. There's lots of stuff. Church halls already used, libraries, town halls, bus stops. I really like that one. Play parks, walking and talking outdoors, away from distractions, Denise. So it's sort of like I imagine a park, right, or a walk along a river or something really nice. Community spaces, faith centre, schools, Cool. Yes, Michelle, you've pulled up on that one. It can also dispel myths about what we imagine that is and isn't true. And Catherine, that idea I had in my head, community centres are small spaces. And perhaps a little bit underfunded, a little bit shabby looking. That's not the vibe I got from yours. You were like, no, it's huge. There's loads going on. It's really exciting, which it's a really nice way to challenge some of those assumptions, maybe. Again, thinking about making the unfamiliar familiar. And you're maybe working with researchers who don't know these spaces very well. And by talking about them or talking to audiences, you don't know them. By talking about them, you bring them to life. Okay, it's a really nice, it's not really a technique, it's just a thing to do. And hopefully you noticed when Catherine told the story how much more engaging and interesting that is. The next technique then is talk about people stuff. The most interesting thing to human beings are other human beings. All right. That is the most interesting thing to us. We basically don't care about data and graphs and other things. Researchers in the room are going, but we care much more about human beings and human stories. Okay. And this is sort of why one of the really powerful things about having lived experience people or folks with professional experience join into research projects. I was part of a project last year looking at chronic pain. So people live with various sorts of chronic pain, and they paired up with clinicians and practitioners and folks with the experience of living with chronic pain, and we developed talks which they did as pairs that toured around the country, and it was really fun and really exciting. But one of the most powerful bits that both the clinicians and the researchers brought and the folks living with chronic pain is bringing the people side of it, talking about the emotions, talking about what it's like living with chronic pain and the kind of daily choices and the this, that, and the other, and the lack of energy. And then the clinicians talking about the emotional rewards of working with folk and helping folk work through that, or putting interventions into place that help people. We like human things, and that is usually emotional stuff. How does it feel? How do these play? How do these spaces make you feel? How does the research work make you feel? How does the problem that the research is trying to address impact people and human beings? Broadly speaking, humans are empathetic and sympathetic. We will resonate with and connect with other people having good times, other people having hard times. And that is a really strong way to get audiences to care. Right, to get people to draw in. Now, this particular one is an interestingly risky one, because if you know, classically in healthcare settings, you'd maybe tell a story of a patient fighting or struggling against cancer or going through cancer treatment, and it's really horrific, and they feel really ill and their hair's all falling out, and you can tell that story for quite an emotional feeling. There is a balance. Okay, we tread quite carefully around subjects to do with health, and when we're bringing things up to audiences that might be triggering or difficult for them, or whether we get too into, oh yeah, storytelling to make people care, and actually what we end up doing is being perhaps disrespectful of things people have gone through by using them to dramatize our research in some way. So they're very useful. It's very powerful. I get making people care, but just a slight word of warning if you're going to use people's experiences to get people to care like this, is just tread slightly carefully and always be respectful of the experiences people have had. That said, very, very powerful, right? It's a really good way to make, again, like the places, it makes the problems real. It makes the research real. It makes the solutions that you might come up with in the research real, or the interventions. You know, if you're doing that evaluation kind of piece and going, actually, no, it made a difference. Look, here is Hillary, who's got 3 kids under 5, and her hair is falling out and is completely stressed. But actually, the intervention we did where we managed to get, this particular bit of child healthcare into a local health centre rather than her having to go to the big hospital, made a huge difference to her life. And those little stories of people are like places. It helps us imagine the work, just gives us that way into the work a little bit better and a little bit more powerfully. So those are 2 big headline techniques. Don't be afraid to put your own lived experiences in, but also other people's experiences and emotional stuff in. Don't be afraid to put places in. When I said at the start, it's not just about academic stuff. That's because mostly the academic stuff to most people is boring. This stuff to most people isn't boring. And so if we want people not to be bored by our engagement and our communication, we need to put some of this in. Yeah, good point. Catherine's just kind of joining in on the sensitive topics. Always good to put trigger warnings in if needed. Yep, and signposting to support channels. If any of you are working on projects that deal with difficult or tough subjects that might affect people, always good practice to do that. Yeah, just be careful and be sensitive. If you are working in those spaces and you want to use these techniques, a quick extra technique, added bonus technique, is to tell the story from a different perspective. So telling the patient story, for example, might lead you into quite emotive, quite triggering, quite difficult territory, but telling the same story from the perspective of the clinician, of the doctor trying to treat them, or the researcher staring down the microscope trying to make a cell do a particular thing, or applying different treatments to a cancer cell, that can give you a way to tell the story and help people imagine the story, but at 1 or 2 steps removed from those really pointy emotional issues. It can also be a way, in healthcare, we hear patient stories all the time, which is not a bad thing. It should be centered around patients or people suffering. But actually, does that mean there are people's voices and stories we don't hear so often? We don't hear carers' stories so often, for example, or family members, and how these things affect them quite so often. So it's a useful exercise to try and help think about whose perspectives we don't see so much as well. Okay. Another technique, this one coming up, is specifically more help in that kind of, I guess, that dissemination space, that unfamiliar to familiar space. And it is the idea of metaphor. Metaphors are fab, they're really powerful. We've had one already. Beach ball, although I think it probably is an analogy. Somebody called me out and said, I really love that analogy. I'm dyslexic and I can never wrap my head around what was a metaphor and what was an analogy. Can't even say it. But communication is not playing catch in the park, right? I use this, which is familiar to you, the idea of playing catch, and I make it more familiar by painting a picture, right? Getting you to imagine playing a park, that makes it really familiar. So you get that, you get this two-way nature, and it only works if everybody's playing. And then I apply that to the idea I want you to think about, which you're not familiar with, which is that communication also has to be two-way. It's no good just throwing the ball at people. And that's how metaphors work, right? We take something the audience is familiar with, something in their world, something in their life that they're familiar with, and we take the thing we want to tell them about that they're unfamiliar with, and we find points that connect across. It's kind of like this, right? That's the phrase I use a lot if you're using a metaphor. So this thing that you don't understand is kind of like this thing you do understand. And we map those two on top of each other. And it's a really powerful way to get people to understand stuff quite quickly, particularly useful in things like those of you who are getting more involved in research design or study design or data analysis and how you do a data analysis. Some of those quite abstract things, it can be really useful to be like, okay, this is quite abstract, it's hard to understand, but it's kind of like this thing in your life that you do know. The equality-inequality example that I really like is, I don't know, some of you may have seen it, but imagine 3 people watching a football match, and they're standing behind a fence looking over the fence at the football match. But these 3 people are all at different heights, or they all can see at different heights, right? So there's a tall person, there's a slightly shorter person, and there's an even shorter person, or it could be somebody in a wheelchair or something, right, where their view height is lower. Now, if we treated everybody equally, everybody would get the same height box to stand on to look over the fence, right? Everybody would get the same height box, because that's the thing, the same and equal output for everybody. And what that means is the tall person gets to see absolutely tons because they're over the top, the middle person gets to see tons, and the person who's smallest can only just see over the fence. Everyone can see over the fence, so nominally goal achieved, but we've still got inequality in what we've got there. Whereas if we treat people equitably, so the goal is to get everybody to the same place rather than treat everybody the same, because people are different, we give people different height boxes, right? And so therefore everybody ends up at the same height, but they have different height boxes. Now, that is a metaphor for equality and equity and treating people differently, and it's often used for things like economic arguments and things like universal basic income and this kind of stuff, right? But you can, in a way that if I said, what do you know about the equitable use of finances and social care, for example, that maybe feels like an unknown, a difficult thing to wrap your head around. 3 people watching a football match, what size of box do we give them? That is a thing you can go, okay, I can see this makes sense, I can understand how this works, and I can understand why it's fair or unfair in different combinations. Does that kind of make sense? I think it's a really good one. I tried to grab a picture of it, but I couldn't find one in time. The other part of this that I think is quite interesting is metaphors is examples. So this is not quite the same as a metaphor. Examples are, here is an actual example of the thing occurring. So really nice. There you go. Denise has found a picture of the equity picture. It's a really useful one. And you can stretch that metaphor a lot. You can do things with different sizes of boxes and different sorts of boxes and various other bits and pieces. Examples are not quite metaphors because it's not kind of like, it's here is an actual concrete example of the thing. So again, thinking about your professional experiences or your lived experiences or the experiences of folk in the kind of community that you're working with, providing real case study type examples of, say, the problems that these people face that your public health study is trying to address, or at the other end, the examples of what the outputs of the study achieved or maybe didn't achieve or changed or didn't change. Real hard examples are always very, very helpful as well. The reason is it's a picture of a roundabout is I once had to create a show for children about the science of spinning things, and the most helpful example we could find that a 10-year-old would understand is going really fast on a roundabout to talk about the science of spinning things. So these are kind of techniques. Tell stories about people, tell stories about places, put these in, and they could be big. Once upon a time we were here in the storytelling, or it could just be like, you know, imagine a beach ball, or it could just be simpler, right? So we went into the community centre and it was really bustling, right? There was loads going on. There was mums with prams everywhere. They had loads of different clubs there. And then straight into the research. You don't have to spend tons of time doing this. You can drop it into these bits of communication and it still has an effect. But crucially, if you're going to go deep into it and tell particularly like a case study or an example, have a point. What is it you want the people you're talking to take away from hearing about this person, hearing about this place, hearing about this case study? Kind of like we mentioned, somebody mentioned faith stories or religious stories earlier. And a lot of religious stories have some sort of lesson baked into them, right? So-called morality tales that are about, here is the story and here is the lesson about how we behave or how we treat people that you're supposed to get from it. Yvonne, drip feed the information indeed, but also drip feed like the engagement, right? It doesn't all have to be, this is all science and data and this is all fun storytelling and people and engagement. They can be jumbled up and mixed in to kind of make it a little bit more helpful. Cool. So hopefully that's useful. Here is a useful structure. So this one is a slightly abstract one. Some of you may not be thinking in a way that this is useful for, which is absolutely fine. Some of you may find this useful. So this one, if you love this, great, have it. I think it's a useful tool. If you don't think it matches, don't worry too much, but it's a structure I teach researchers to use when they're communicating about their projects, and it might be helpful to you as well in various different ways. When we are talking to people who don't know about a project, so it could be going back into a community and talking about audience, or talking to policymakers, or talking to other community folks or other researchers who aren't familiar with the project, a really quick breakdown structure of essentially why we did it, what we did, and what has happened because of it looks like this. Start with the problem. This is the problem the study was designed to solve, right? This is what we tried to do. This is what we did. We went into community centres. The community centres looked like this, right? And we gathered all of this information or data from people, or we got their lived experiences or whatever, and we included them. And we designed a study with them first that did that. And then this is the outcome. So problem, strategy, and outcome. So here is the problem. This is what we did to try and address the problem. And then the outcome, crucially, is connected back to the problem. Did we solve the problem? Did we not solve the problem? Did we learn that it was a more complicated problem than we thought to start with, and we'll have to come back and do another project on this? Have we run out of money, please, and give us some more, and we can keep working on this and we'll get you an outcome in the end. So it's really good for that sort of reporting stage to various different funders or various things like that. So stakeholders, that's the word I was looking for. Funders or involved people who want to hear how the project is going and get a kind of a headline off it. Cool. That's a really useful structure. The last piece I wanted to give you before we open up to Q&A is about this idea of confidence. I mentioned at the start that presenting in some of these spaces might feel difficult, might feel scary because it's outside of your experience. Confidence comes from preparation and experience. Experience is do it, feel the fear and do it anyway. Preparation, though, there's 3 key things, right? Don't just know your stuff. Know your stuff is not helpful. Know your purpose. Know what you're trying to achieve by communicating this thing, right? Are you going back into the community and you want people to accept the public health kind of intervention when it comes? Are you going to policy and you want people to support it at local council or to fund it or offer money? Are you talking to researchers and you really want them to understand a specific subtlety of the real world experience that they don't seem to have grasped in their study design? What are you trying to achieve, right? Know that, get clear on that. Know what you're going to say. Go into these settings having practiced it, okay? Even though they are your stories and pulling from your own experience and your own lives, that doesn't necessarily mean it's not good to practice. It's good to really rehearse what you're going to say and think about it. Presenting is scary, right? It can be nerve-wracking. You can forget what you're going to say. Practice, know your stuff can really help you feel more confident. And finally, think a little bit about your audience. Adapt and change. We had Emmy's comment earlier about, is storytelling always relevant? And no, it's not always relevant. You have to think a little bit about who your audience is, what matters to them, how we connect it to them, and how we make them care. And if you have these in mind, your preparation will go a little bit easier. And yeah, hopefully your communications will be good. And that's the last big thing I want to share with you.
Thank you so much, Duncan. There's a lot of people have mentioned in the chat how much they've enjoyed the session. Some really lovely comments to go through. So thank you very, very much and really enjoyed it. Thank you.